By giving up carbohydrates, you force your body to burn fat. What happens actually to our overall body fat? You can't empty a tube by widening the drain if you're also cranking open the faucet. Low-carb advocates have a theory, the so-called carbohydrate insulin model of obesity. As per their theory, the decreased insulin secretion will lead to less fat storage. So even if you were eating more fat, less of it would stick to your frame. You will be burning more and storing less. The perfect weight loss combination. Or so the theory went. Instead of just speculating about it, they decided to put it to the test. 17 overweight men were effectively locked in what's called metabolic ward for 2 months to allow the researchers total control over their diets. For the first month, they were placed on a typical carbohydrate-rich diet, 50% carbs, 35% fat, and 15% proteins. And for the second month, they were placed on a ketogenic diet, 5% carbs, 80% fat, and 15% proteins. Both diets had the same number of daily calories. If a calorie is a calorie when it comes to weight loss, then there should be no difference in body fat loss between the ketogenic diet and the regular diet. If fat calorie is somehow less fattening, then the body fat loss should be more accelerated on the keto diet. The subjects went from losing less than 500 grams a week on the regular diet to losing 1.6 kg within 7 days from switching to the ketogenic diet. What was happening inside their bodies, however, told a totally different story. On the keto diet, the rates of body fat loss were slower by more than half, so most of what they were losing was water. The reason they started burning less fat on a ketogenic diet is probably the same reason people who start fasting may start burning less fat. Without carbohydrates, the preferred fuel, their body started burning more of their own protein. Switching to a ketogenic diet made them lose less fat mass and more fat-free mass. That may explain why the leg muscle of CrossFit trainees placed on a ketogenic diet may shrink as much as 8%. The study subjects did start to burn more fat on a ketogenic diet, but they were also eating so much more fat on that diet that they ended up retaining more fat, despite the lower insulin levels. This is diametrically opposite to what the keto crowd had predicted. In science speak, the carbohydrate insulin model failed experimental interrogation. In a separate experiment, Dr. Hall showed that if you cut about 800 calories of carbohydrates a day from your diet for 6 days, you lose 53 daily grams of body fat. But if you cut 800 calories of fat, you lose 89 daily grams of body fat. That's 9 pots of butter worth of extra fat melting off their bodies every day. Same number of calories, but 68% more daily fat loss when they cut down on fat instead of carbs. After 6 days on the low-carb diet, study subjects lost 1.8 kgs, but they lost less than 1.4 kg on the low-fat diet. Less loss of body fat, but stepping on the scale, it looks like the low-carb diet wins hands down. So it's easy to see why low-carb diets are so popular. The low-carb group was losing lean mass, water, and protein. As one of weight loss experts noted, rapid water loss is a $33 billion diet trick. What we care about is body fat, not water weight. A meta-analysis of 32 controlled feeding studies swapping fat and carbs found the same thing. Less fat in the mouth means less fat on the hips, even when taking in the same number of calories. What about suppression of hunger? You may lose less body fat on a ketogenic diet than on non-ketogenic diet, consuming the same number of calories. But out there in the real world, all these ketones may spoil your appetite and you end up consuming significantly less. On the low-carb diet, people ended up storing 340 more calories of fat every day. But outside the laboratory, being in a state of ketosis could allow you to offset that if you were able to sustainably eat sufficiently that much less. The answer to a systematic review and meta-analysis entitled "Do ketogenic diets really suppress appetite?" was yes. Additionally, ketogenic diets offer the advantage of being able to track dietary compliance in real time with ketone test strips. You can pee on to see if you're still in ketosis. Keto compliance may be more in theory than practice. Even in studies where ketogenic diets are being used to control seizures, after a few months, dietary compliance may drop to less than 50%. Ketogenic diets are used since decades to treat certain cases of pediatric epilepsy. The main issue would be nutrient deficiencies. Children have gotten scurvy, a disease caused by severe and chronic vitamin C deficiency, and some have even died from deficiency of the mineral selenium, which can cause sudden cardiac death. The vitamins and mineral deficiency may be solved with supplements, but what about the insufficiency of prebiotics? Not surprisingly, constipation is one of the most frequently cited side effects. Starving our microbial selves can have unlimited negative consequences. Ketogenic diets have been shown to reduce the richness and diversity of our gut flora. Microbiome changes can be detected within 24 hours of switching to a high-fat, low-fiber diet. Human studies have shown a drop in beneficial bifidobacteria and a decrease in overall short-chain fatty acid production, both of which would be expected to increase the risk of gastrointestinal disease. What might all that saturated fat be doing to the heart? A meta-analysis of 4 cohort studies following the diets, disease, and death of more than 250,000 people found that those who eat lower carb diets suffer a significantly higher risk of all-cause mortality, meaning they live on average significantly shorter lives. In a Harvard study of heart attack survivors, those who adhered more to a lower carb diet based on animal sources of fat and protein had a 50% higher risk of dying from a heart attack or stroke, but no such association was found for lower carb diets based on plant sources. Every kg of weight loss by any means is associated with about a 1-point drop in cholesterol levels in the blood. But when people are put on ketogenic diets, the beneficial effect on bad LDL cholesterol is blunted or even completely neutralized. Counterbalancing changes in LDL size or HDL cholesterol are not considered sufficient to offset this risk. You don't have to wait until cholesterol builds up in your arteries to have an effect though. Even with about 5.5 kg of weight loss, artery function worsens on a ketogenic diet instead of getting better, which appears to be the case with low-carb diets in general. It is known for a century that if you put people on a ketogenic diet, their carbohydrate intolerance can skyrocket within just 2 days. 1 week on an 80% fat diet, and you can quintuple your blood sugar spikes in reaction to the same carb load compared to a week on a low-fat diet. Just a single meal high in saturated fat can make the cause of diabetes, carbohydrate intolerance, worse within 4 hours. With enough weight loss, type 2 diabetes can be reversed. On a ketogenic diet for diabetes may not just papering over the cracks, but actively throwing fuel on fire. Type 2 diabetes is reversed when you have normal blood sugars on a normal diet off all medications. In other words, it is reversed when you're no longer intolerant to carbohydrates. One of the ketones you make on a ketogenic diet is acetone, the nail polish remover. Acetone can oxidize in blood to acetol, which may be a precursor of methylglyoxal. That may be why non-diabetic keto dieters can end up with methylglyoxal levels as high as those with out-of-control diabetes, or end up with a heart attack. So the irony of treating diabetes with a ketogenic diet extends beyond the potential of making the underlying disease worse, but by imitating some of diabetes' terrible consequences. For non-athletes, ketosis can increase the feeling of perceived effort and fatigue during physical activity, which could potentially undermine exercise efforts. A ketogenic diet may blunt the performance of endurance athletes and trainers as well. What about bone loss? Sadly, bone fracture are one of the side effects. For children placed on ketogenic diets, along with growth stunting and kidney stones, ketogenic diets may cause a steady rate of bone loss, presumably because ketosis can put people in a chronic acidotic state. Ketones themselves are acidic and can result in a mild metabolic acidosis. As with anything in medicine, it's all about risks versus benefits. Up to 30% of patients with epilepsy don't respond to anti-seizure drugs, and the alternatives aren't pretty, including procedures like brain surgery. This can obviously lead to serious side effects, but so can having seizures every day. So, if a ketogenic diet helps, the advantages make it worth, despite the disadvantages. For those choosing a diet to lose weight though, the cost-benefit analysis would clearly seems to go the other way. Ketogenic diets are not recommended. When you think of the ideal attributes of a diet for weight control, safe, sustainable, effective, wholesome, nutritionally complete, life-extending, typical keto diet guarantees none of them. See you soon.